All right. Well, we're going to go ahead and get started. Welcome everybody to our second virtual IHPI seminar series. We are extremely excited to be able to be doing this virtually and extremely excited today to have Dr. Preeti Malani presenting about college campuses and COVID-19. Dr. Malani is the Chief Health Officer, as I'm sure everybody knows. She's a professor of medicine in the Division of Infectious Diseases. She's the director of the University of Michigan's National Poll on Aging. And as I think all of you know, her clinical expertise includes infectious disease and geriatric medicine. Dr. Malani has been just extremely busy, and so we're super fortunate to have her presenting today. She's been everywhere over the last several months, several news venues, several editorials, really helping us at the university get through this pandemic of COVID-19. So we're just thrilled to have you, Preeti, talking today about some of that and your experiences. And I'm going to let you take it away. I just want to do a couple of housekeeping things. Just like the last seminar, we're going to let Preeti present, and please put your questions in the chat function. I will monitor that throughout the talk, and at the end we'll have hopefully some time for discussion. I'll try to collate questions and ask them of Dr. Malani, but also letting folks unmute and ask your own questions if time allows. So thank you so much, Dr. Malani. We are just thrilled to have you presenting today. And I'll turn it over to you.
Thank you, Sarah, and thank you everyone for making time on this beautiful fall day to hear a bit. And although the title is College Campuses, I'm actually going to try to focus a little bit on what's happened at Michigan this year. And I was telling Sarah that I somehow I thought this was going to be something smaller, to a group of students, and then I realized it was, the seminar. And so I did put together a few slides. There's not a lot of data here. There are not a lot of data, certainly not any research, but I thought I would have a conversation, kind of share some general thoughts, and then hopefully, I'm sure there'll be a lot of questions on this topic because this is really something that is unknown. What lies ahead is unknown. And, it's an honor to be here to represent the university and to share a bit about our pandemic planning journey. I would almost call it like an odyssey. And as Sarah mentioned, I have really been everywhere. I feel like I've been everywhere, although I've been nowhere. I've only been in Ann Arbor, in my house and at the hospital. But I've given a number of talks on this topic in lots of different venues and places that I really never thought about. Education Writers Association, Chronicle of Higher Education, Alumni Association, sepsis researchers, we're kind of interested in this, Council of Foreign Relations, Lifelong Learning Institute. But to be here with all of you as health services researchers, as clinicians, as researchers, as policymakers is really an honor. I think it's a little bit different kind of conversation. So I'm glad to be here. And although I'm here speaking to you, this is in no way my work. It's the work of hundreds of people who have been at this since January. Dean of Students, the DPSS, the environmental health and safety folks, housing, dining, the executive officers, the provost, the president. But there are three people that I just want to name because they are extraordinary, and I actually get emotional when I think about them and I think about what they have done. First is Dr. Rob Ernst, who is a general internist. A lot of you know him. Some of you are probably fortunate enough to have him as a doctor. Rob is the Associate Vice President for Student Life, Health and Wellbeing, and he is really the hammer that is like going 24/7 on this project and really helping coordinate all the operations. Rob's right-hand woman is Lindsay Mortensen, who is a psychiatrist, extremely talented. She is the medical director, executive medical director at the health service. I feel like she has guided me in public health this year because of her ability to stay on top of something that is changing hour to hour. And then Emily Martin, who many of you know, she is a member of IHPI. She's a associate professor at our School of Public Health and infectious disease epidemiologist, and she's been advising everyone, everywhere, including our governor. And the three of them are the folks that are really been central this fall. And so, like I said this in a tweet earlier today, if you see any of them virtually or in person, thank them, because I think it's hard to overstate how much they have done and what they've given. So if I could have the next slide, please. So college campuses are really built around the idea of togetherness and density. And whether it's a residence hall, a classroom, or the student section of the big house, and I have a photo here of my beloved Michigan Wolverines, retrofitting it for the opposite is really difficult, if not impossible. And I think a few caveats that I want to share, really, that this is hard. There's no easy playbook to figure this out. And things, as I mentioned, things are changing. What we knew even in August and September is different than what we know right now. And I have likened the whole process to making a boat out of a car, which means it is imperfect, it is messy, it doesn't look so good, but you know what? We're 6 weeks into the school year and we're floating on the water. We're going. And I think that is not a small feat. There's complexity and uncertainty, and things keep changing, and we continue to adapt to change. I want to think back to January. So as you heard from Sarah, I'm an infectious disease physician. So I pay attention to random reports from the WHO. And there was one that kind of came to my attention in early January around a cluster of infections that were occurring in China. And I actually sent an email on January 20th to my boss, the University of Michigan president, Dr. Mark Schlissel. And I sent him this email. I recall it because it was the last trip I ended up taking this year. I was in the lobby of a hotel in Utah, and I said, I think I should just send him an email because he likes to know this stuff. So I wrote, I have a copy of the email. I'll read it to you. I'll read part of it to you. Dear Mark, Happy New Year. Quick update. I'm sure you've heard about the outbreak of respiratory illnesses from Wuhan City, China, believed to be a novel coronavirus. So like SARS and MERS, situation is dynamic, but risk of person-to-person transmission appears to be much lower than SARS. Lots of unknowns right now. CDC, WHO are involved along with Chinese public health. We are taking our lead from the CDC and State Health Department. I went on to say, the message at this point, which may change with updated information, is that anyone who traveled to Wuhan City and becomes ill with fevers and respiratory symptoms should seek medical care and self-identify at risk. And use of masks is standard in all our health settings. And, I basically went on to say, I guess this is just like an FYI. We'll just dust off the infectious hazards group and get everyone together. And at that point, we were really more concerned about our own students and faculty that might be in China. But I also noted that it was dynamic and that, just let you know. If I could get the next slide. Oh, I think we're on the wrong slides. Maybe back up. Yep, okay, you can leave it there. Yep, you can leave it there. It's just kind of a placeholder. So here we are now. We are into our 8th month of the US pandemic, and COVID has changed everything, not just in healthcare, but how we interact, how we learn. Back in March, which, I have to say, it really feels like a lifetime ago, certainly for me, probably for all of you. Within a matter of days, every college in the United States made a rapid, unplanned pivot to remote learning. And I would say at that moment, it was like flipping a switch. It was just like turned off the light, closed the door, and just said, everybody go home who could go home. And we were not as vocal as some of the universities were about getting people home. And it took us a little while to empty out campus. But at that moment, the prevention of infection transmission was the only consideration. And COVID was the only health issue that mattered. There were lots of concerns about equity and inclusion and overall health and well-being, as well as safety. It's hard to learn remotely. People don't have access to Wi-Fi or other technology. Depression, anxiety, loneliness are already at epidemic levels. And we knew that the isolation was going to get worse, but really it was the risk of COVID that drove all the decisions. And those of you who are like me, who work in the clinical world, it's hard to really even describe how it felt during that time back in March and April. Really felt, my brother, who is an infectious disease doctor at St. Joe's, he's one of our adjunct faculty, he described it to me. He said, you feel like you're in the band at the Titanic playing while everyone is leaving the ship. And I think it really was a really difficult time. And on campus, it was difficult too. And campus kind of emptied out, and we learned a lot of things since then. Clinically, I think a few things stand out. We've learned a lot clinically, but I'd say the big things from the standpoint of public health and getting the campus back to face-to-face learning are that asymptomatic transmission is really important. We weren't sure of that back in March and April. The other thing that has become very important and very well known is the importance of face coverings in terms of prevention. Masks work. The other thing that has changed is the fact that the environment is probably less important than what we thought, and that people aren't in fact getting COVID from touching surfaces, and that it's a person-to-person transmission. Testing has also evolved, and at the beginning, back in January and February, every single person that got tested had to be cleared by the state health department, and a lot of people who were felt to meet the definition couldn't be tested because there were such limitations. And again, just a few months ago, but remember that there was hardly any testing available across the country. We couldn't test, so everyone just had to stay home. Now it's October. We have returned to in-person, in-residence learning at the University of Michigan, and it has been dubbed a hybrid model with many things planned as remote, and some things, smaller classes and some activities, are in an in-person format. I will say that in the best of circumstances, getting back to face-to-face learning was going to be difficult. And I think over the course of the summer, we had these moments where we're like, how are we going to even do this? And as you may know, several schools that had initially planned on being in residence rescinded those decisions, really even to the last days of August, because it's so complicated. And I was just talking with Sarah, who, like me, is a parent of a college student. My son is actually a student at Michigan. So he's, I kind of get the little insider scoop from him, but we were just talking about this, that Michigan State is, we kind of have a small cluster randomized trial in our state, if you will, of an N of 2, where Michigan State is sort of fully remote. But I want to point out that being remote doesn't mean students are not here. Being remote means maybe there aren't going to be students in your residence halls, but it doesn't mean an empty campus. And that was one of our considerations. Now, this is different than like a smaller liberal arts school where everyone lives on campus. It's a little bit less porous, the people aren't coming and going. But for us, as all of you know this from being in Ann Arbor, we have people living with students in co-ops, for example, who aren't even students here. They may be at Eastern, they may be at Washtenaw Community College. So when we talk about, quote, closing campus, it really means first-year students in the res halls. And as you may know too, and some of you may have students who fit this description, this year's first-year students also lost the second part of their senior year. So this is a pretty motivated group, and we ended up deciding to bring them, and I'll talk to you about that a little bit. So could I get the next slide? So in late June, the University of Michigan announced plans for a public health informed in-residence semester. It was a long-awaited announcement. It was very exciting for people. Of the Big Ten, we were number 14 of 14 to make that announcement. And I will say, and I'm going to talk a little bit about the process of getting us to that. There was a lot of discussion that got to this point, and as you have seen from the past 6 weeks, you can resume residential learning in a careful and thoughtful manner that mitigates risk with the understanding that there will be residual risk. And there will be cases of infection, even with the best of planning. Return to in-person learning in a college setting can only happen if community spread is controlled. And that is one of the considerations. Returning to face-to-face learning is also not a zero-risk proposition, but it takes into account that the value of in-person instruction assumes some level of risk. We don't always talk about the why, and I think this is an important discussion, and there are lots of whys for this. And again, I look to East Lansing, to what may have felt easier to be fully remote, but that too has not been simple for Michigan State. And in fact, at Michigan State, they are having a lot of cases of COVID, and they're having trouble keeping track of who's there and who's not, because even though the residence halls are closed, there are lots of students there on campus. We have, prior to the fall, we had some experience getting other spaces back to quote return, and the research space, which many of you work in, was one of the first places that came back, and Rebecca Cunningham, our Vice President of Research, led that effort. It was a monumental effort. We were able to do that without any secondary spread and no effect in the clinical setting, where we have actually been working and having close contact for long periods of time, whether it's outpatient clinic and other places where there's not routine testing. So we'd had experience saying that we believe this can be done, and we believe it can be done safely. And the biggest consideration was to make sure that anyone in the community who's vulnerable is given a choice, one, to not be in the community, and second, this idea that we have to make sure that we're not spreading uncontrolled anyway, whether it's in the residence halls or in the fraternities or certainly in public spaces. And I'll talk about that, what's actually happened. I will say that infections that have been identified within university employees, if you look at the case investigation, these have been linked to social gatherings, not being on campus for work. Now, this is different than March and April, during which there may have been some transmissions, particularly among our essential workers. And I think that just reflects what has happened, particularly around universal masking. So a little bit about our approach. I mentioned this phrase, public health informed in residence. And public health informed does not mean 0 cases of COVID. It means the ability to contain COVID. It means identifying cases, having quarantine space, doing the contact tracing, obviously taking care of anyone who's sick. And certainly don't want anyone to get sick, but if they get sick, we have a way to take care of them. We have a way to support them. And those were the different pieces. And I'll talk a little bit about that. I mentioned that the return to research gave us an opportunity to sort of pressure test some of these thoughts, some of these ideas and interventions. So what we have returned to is a mix of in-person and remote classes. The breakdown is about 25% in-person and about 75% remote. There are a lot of first-year students who are pretty much all remote. My son, who is a third-year student in engineering, he is fully remote, but he's on campus. In music and dance and in the health sciences, there's obviously much more in person. So, these courses were structured in a way that made sense based on the pedagogical requirements and also based on what the schools and colleges needed to do. And things were structured in a way to promote best practices from public health standpoint while fulfilling the university's fundamental mission of education. I mentioned the why, and I'm not sure if I actually got into it, but this idea of we are an education institution and a research institution and also a clinical institution. Can we continue those core activities in a way that's safe? The other big consideration is that COVID, unfortunately, and it pains me to say this, is that it's here to stay, and that there's not going to be one moment in the next few months or even potentially even within the next year where we're just going to go back to normal. And so can we learn to continue some of these activities in a curtailed but safe manner so that people can continue their education? And we can talk more about this, but some of the thoughts that we talked about were you have disproportionate effects on people based on socioeconomics, based on other considerations. A lot of students whose parents are essential workers lost their jobs. Some of those, if they are not able to come to campus, can they learn? Are they going to be taking care of younger siblings who are also at home right now doing virtual school, K through 12? Are they helping with the family business? Are we going to have issues with retention? So there are compelling reasons, and it was, anyway, I will just say that it was a good, robust discussion, and the feeling was that we could do this safely. And so, here we are. Getting to this announcement in June required hundreds of members of the U of M community. It's a very detailed, very robust process. I sort of joked with my Big Ten colleagues that, in sort of typical Michigan fashion, we did all the extra credit, we did the extra homework, we turned it in. It was like 100 pages long. But but we were the last ones to make that announcement. I felt like a lot of other people got to that announcement without all the groundwork. But this has been how the pandemic is that you just have to, unfortunately, make decisions without having all the information sometimes. The guiding principles were the health and well-being of campus as well as the surrounding community, top of the list. And as I mentioned, that COVID is here to stay. So like, how can we adapt, can we do this and still be a little bit flexible? The advisory groups included a big group on public health, which I was part of. Another one was on ethics and privacy, and John Ianian and Gilliman oversaw that group. The provost had several subcommittees on really every aspect of education you could think of, so studios and performances and labs and graduate students, international students, foundational courses, academic spaces, instructional planning, like every aspect that you could think of got looked at. And again, it was a very, very in-depth, diverse process, and it was done remotely, much like this presentation today. One of the things that was made very clear by the university's leadership is that the fall semester is going to look and feel different than anything seen before. And that the basic public health strategies that all of us have gotten used to, social distancing, wearing face coverings, keeping track of your symptoms, washing your hands, testing, contact tracing, quarantine, minimizing out of area travel, those would all be there. And then the hardest one, which I'll talk about, is limiting large gatherings. And on this one, we work closely with the Washtenaw County Health Department, and I just want to make a shout out to them. They have been amazing partners. We have a very unique situation at the university where we have a more formal relationship, I will say, to do contact tracing and to do case investigation, and that's been there for years. So our environment, health, and safety group has done outbreak investigation, let's say for norovirus, and they get deputized by the health department. So one of the things the health department did was put an order in place in Washtenaw County for outdoor gatherings to be limited to 25. And again, this was an effort to make sure that people weren't having gigantic parties. But there was also a big effort to engage the students on this. And there was a formal committee of students, of really every aspect of the student body, to sort of help sort out what can be done, what can't be done, and really bringing the responsibility back. I will say, as a mom, I push back on the narrative that young people can't be trusted and that they all are going to misbehave all the time. There are older adults that misbehave a lot too. And so I think this is one where we really worked hard with the students to say, this is the only way we're going to be able to stay here. This is like, we're going to all stay swimming together or we're going to all sink. And I have to say, I feel like, and this is anecdotes, is that they have adapted. They are gathering, and it is important for them to gather. Like if they live in a house and they're sitting on the porch together, I'm not worried about that risk. I'm worried about 200 people on front lawn, but I have to say I'm not seeing that this year. And again, the students, as much as they can, they have been trying to put in their own sort of guidance in this. The fraternities and sororities, for example, have limited their social engagements. Now, does that mean that there are no parties happening on campus? No, but it's less, and I feel like it has been manageable, and that's been part of the success so far. The slide you have here, the blueprint name implies that things are adjusted as conditions change. Also, the idea of managing expectations. I actually thought it was such a great name that our marketing folks came up with. Couple things that probably many of you know, that with instruction, choice was really important. There are some students that, even with restrictions and with efforts to limit spread, it's just too high risk of an environment for someone to come back to. And it's the same thing with some faculty members. So people were given a choice on whether or not to take their classes remotely, to teach remotely. There are other reasons why people can't be here. We know that a lot of people have concerns around returning to learning. And this has been, I think, one of the more difficult things. And, I think back to how I felt in March and April, and I realized that a lot of people feel that way still because they haven't really been able to fully engage in a safe way. And it does feel risky to some people. So I think that's been an ongoing discussion. with variable success, I will say. The decisions about what to teach really depended on the college and the schools and the departments, depending on what the needs were. But in general, large classes, remote. Small classes, potentially in person. Medium, kind of a hybrid. And like everything else, these decisions were made in a public health informed manner, including how big is the classroom space, what's going to be available. The other classroom buildings were also de-densified. There are fewer seats. There are limitations on the use of gathering areas. And this has come up this week. I actually, some of the emails I sent this morning was to our student life folks. And I'm like, you know what? It's midterm time. We've been here 6 weeks. Can we start opening up some of the common spaces? Because I'm worried that students don't have a place to go study. So, these imperfections kind of, they come up in unexpected ways. You have to show an ID to get into certain buildings. You have to maintain physical distance in certain spaces. There are limits on how many people can be in spaces. One of the other things, and I know there are folks here that have studied education in a very deep way, remote teaching is different. And there have been resources put into trying to make that better, and whether it's course design or creating instructional communities. The academic calendar has also been redesigned. Our fall break would be falling about right now, and that was eliminated because that travel piece introduces a lot of risk. So the idea was show up here, don't plan on leaving until Thanksgiving, and then at Thanksgiving leave and don't come back until mid-January. And to be honest, we haven't really talked about mid-January and what it's going to look like. We know that it's going to be cold and people won't be able to be outside as much, and potentially there could be high numbers of infections. We also don't know what kind of timeline is going to be out there around vaccines. So, so much of this is like you have to move and adapt on limited time and limited information sometimes. But anyway, all these measures together sort of form a stackable set of interwoven interventions to really try to make things safe. One aspect is the daily symptom monitoring. Do you have a cough? Do you have a cough? Are you short of breath? And I think all of you have gotten used to that, the response of blue. And the utility of this you can debate because, obviously you can just say, oh, I feel great. But this is something that helps us monitor the whole campus. Like, is there a particular hall in one of the residence halls where all of a sudden people are having coughs and fevers? So that, so far people have been completing it when they need to. We haven't gotten as much uptake in the residence halls because frankly, people aren't needing to leave that much. The, if I could have the next slide, I think some of you have seen the dashboard, and there are people who I know look at this very, very closely. Some of the things that you'll see is that the cases were really high 2 weeks ago and that they came down last week. And then so far this week, they're kind of okay. So we'll see where we go. One of the things that we learned is that a lot of students were going off-site to get tested. They're getting antigen tests at the urgent cares. And we made it a point to say, you know what, those results do come back to us, but they are delayed. And they are delayed, and that delays you getting out of your space, potentially putting more people at risk. And more importantly, it delays you getting connected with resources, whether it's to quarantine housing or to academic support or medical care for that matter. So it's like a constant process of information. I feel like Rob Ernst and Lindsay Mortensen and I are like detectives, and we're trying to figure this out every day. What we also thought was happening with the antigen testing was that maybe people were trying to get tested to be able to go to parties. And we didn't have proof of that, but he and I are both Michigan parents, and we kind of had this suspicion that maybe that was happening. And again, for those of you who are following the news, you can hope you agree with me, is that testing is not the same as prevention. We've seen that at the White House, where testing was used quite liberally, but the basic prevention steps were not taken. And so far, it looks like there's quite a few cases, and there may be more. I just mentioned about quarantine housing. This is another thing that was important, and there have been units set aside for students to be able to live in for either their quarantine period of 14 days or potentially isolate while they're ill. This is something that you also need to check in on them emotionally. You need to make sure that they're fed, laundry services, other things. So there's like a whole process that goes into the care of those students. And you know what the dean of students told me the other day, that there was a mom who wanted some birthday presents delivered to her daughter who was in quarantine, unfortunately, and that did happen. I know that there's attention brought to some of the negative stories that come out of there, but I can tell you that I think people are doing their best. It's not ideal. I think there's a lot of distress for people who end up in those situations, and there are trained individuals, caseworkers, who actually work with the students one-on-one and try to offer that support. But you know, I have to say, I think it would be miserable to have to spend 14 days by myself in a strange place. And so it requires a really holistic way of caring for students. One of the other considerations was that Michigan medicine is around the corner. Thankfully, we haven't had to rely on Michigan medicine's capacity to take care of students. I'm aware of one student who has required hospitalization and was fortunately okay. Most of the students have had very mild to no symptoms. And again, by no means do I think that this is like nothing to them. I actually I care a lot about them not getting COVID. I feel like there's a lot we don't know. Preventing COVID is something we know how to do and we should try to do. And so far, like I said, on a campus of 50,000, 500 cases or so right so far, it's okay. It's not great, but it's not spreading out of control. And so that's kind of where we're at. If we could get the next slide, I think that's, yeah, testing. So I do want to talk a little bit about testing. This is one that I think has really required a lot of discussion. And this study in particular, this is my friend Rochelle Walensky, is the senior author on this. She's the chief of infectious disease at Mass General. She's a superb math modeler, infectious disease modeler, has done a lot of work on HIV. This modeling study got a lot of attention over the weekend, and this was a hypothetical cohort of about 5,000 college-age students without COVID, with the idea that if you have 10 students with undetected asymptomatic infection, what happens, and like how does testing apply to it? And basically, the take-home message was you should be testing everyone every few days. And that was something we looked at, and we wondered, we had a lot of questions, and this was in the summer. You know, does it really translate to our population? This was a small population with high incidence. One of the big worries we had was, would we be putting people into quarantine who have false positives? Because there were a lot of false positives in the study also. And again, it's a modeling study, but if you have a test that doesn't perform that well and you apply it across a population, would we be creating unnecessary harm? I just mentioned, I think quarantine is not a good place to have to be if you don't need to be there. Would we be moving large numbers of students who are uninfected into isolation housing? And so we basically held tight and decided to wait, because we felt that the proposition of doing a test was not zero risk. And frankly, we weren't really sure how to even get it done because testing has continued to evolve. Now, those of you who follow the record know that we have a pretty robust surveillance testing program that Emily Martin helps direct. And again, using targeted epidemiological methods to sort of look at high-risk individuals. And that has been helpful, and we have identified small numbers of people. And tomorrow in the record, you'll read about an expanded program that's going to start next week. I think it may have actually started today, where we'll be testing up to 6,000 people a week. And this will be students, faculty, and staff in Ann Arbor who are on campus. And we're doing this with Arul Chennaiyan and one of his startup companies, because part of it is just having the capacity, frankly, to do the testing and to do the labeling and to follow up on these. And some of you I know are primary care doctors. I mean, imagine following up on 6,000 tests. And so there are things that look simple, but then the actual planning and execution of them could be quite difficult. And what we decided to do was put our resources into masking and really, really focusing on masking. We adapted a policy in the summer around indoor and outdoor masking, universal maskings, other than when you're eating or having a medical procedure or dental procedure. But the idea was we really wanted to get good adherence to that. And I have to say, I'm on campus a lot. I think we've done pretty well with that. Could I get the next slide? So just kind of trying to wrap up here. Most of our students, they live in communal settings, whether it's residence halls or, in houses or apartments. And we really want to, we really thought a lot about that family unit and, trying to help students reframe what they are doing. Because, the idea of a bunch of students just living in their rooms and never leaving, that is trading one risk for another risk. And that's something that I've tried to be very vocal about, that COVID is not the only risk to our health. The risk of loneliness, of depression, of anxiety, of academic difficulties, which I feel like no one's talking about. That may just be like the mom in me, and that it's midterm season, but I'm worried about also being able to do their schoolwork. So we've tried to help reframe students to think about what they can do. And I think, so far it's going okay, although I think it's not uniform. Co-curricular activities, in the last week, the rec sports buildings have opened up. And I have to say, I thought that was gonna really be a heavy lift. I was not optimistic that we could do it. It's been done. It seems to be going well. People have to mask other than when they're swimming. They are full. The buildings, they have a reservation system. People are coming and they seem to be enjoying themselves. And I think, it's that kind of reimagining the campus at every level, whether it's in the library or common spaces or classrooms. And we're not done. There's still places like dining has still been sort of to-go dining. And we're working on trying to get some kind of limited sit-down in-person dining. And again, it'll be with your roommate. It'll be with people that you already share space with, because of course, dining could be a potentially high-risk situation. There are canopies across campus to help people have a place to sit and relax and talk. And again, there's no easy way to do this. There's no one-size-fits-all solution for colleges and universities. And I will say, I think we're doing okay. We have had clusters in the res halls, and this will be sort of one of my last comments because I'm aware of the time here, is that the cases that we see, they all have a social connection. They report close contact with someone else who has previously tested positive. What we're not seeing, thankfully, is transmission in the classroom, in the libraries, in the dining halls, even within the residence hall for people who are trying to follow the basic guidance around limiting numbers, wearing your masks, staying home if you're sick. They're not getting infected. And the reason I know this is because they've done pop-up testing at these residence halls where there's been clusters, because we don't know, wow, are there 200 cases there instead of 15? And what has been found is that there haven't been additional positives, or they've only been a couple positives, and they've been linked in the contact tracing. So again, I think there are some things to me that are reassuring. I feel better than I did in August, but we have a long way to go. And as I mentioned, COVID's not the only risk to our health. And I think a lot of students, I think a lot of faculty and staff are having a hard time. I think this is a time where we feel a lot of sadness and grief. And some are having a harder time than others because of the disruption of our lives. I wanted to kind of end on a couple things. One is the importance of communication. And this has been like one big crisis communication event, really since January. And our public affairs colleagues have been phenomenal. I mean, they are just 24/7 on this. And there's a bunch of them on this. And we still kind of can't keep ahead of the narrative because it changes and it moves. But we've tried to have consistent, straightforward, honest messaging. I think we continue to sort of see what works, and we try to have it in different ways. But I just, again, I don't think this is a surprise to anyone, but that communication piece has been really difficult despite good intentions. The next slide, I think I'm going to skip the video for the purpose of time. Sarah, or do you want me to? I can show this. It's a 2-minute video. Maybe we'll just show it.
Yeah,
I just want to talk about, okay, innovation. Let's just watch this video.
What we've been doing is generating aerosols inside the bus and watching how that aerosol is transported.
Aerosols are liquid droplets in air that can be potential conduits for the coronavirus. The team of Michigan engineering researchers are measuring and modeling the concentration and dispersion of aerosols in buses in order to learn how to better filter them and keep users safe.
So we sampled at the driver location, at different passenger locations, and studied the time response to see that aerosol and how low would the concentration go if the windows were open or other vents were open versus a closed bus with just recirculating air after air conditioning.
By collecting data in a variety of situations, researchers are then able to create models that show the likelihood of coronavirus transmission with a variety of variables such as rider capacity, ventilation rate, and mass usage.
Our model tells us if you have a sick person on the bus and the bus is full, how many people got sick in a 15-minute bus ride?
From this work, university officials have built specific health measures for a variety of situations to keep both riders and drivers safe.
The changes in a nutshell are duration of trip, number of people on a bus, wearing masks, and dealing with the fact that we're going to keep the windows open. It's going to be a little bit different.
This will be a finite period of time. This will not go on forever. We want to get back to some part of normalcy, but we need to do that safely.
Thank you. I just wanted to show that video because I think it's a good example of innovation and also of communication. You know, this idea, you know, the buses were not an easy thing to sort out. In fact, at one point we said, maybe we can't do this because we can't figure out the buses, since those of you who are familiar with campus, you know that students go back and forth to North Campus. And so it was actually also a way to communicate by showing the amount of effort that went into figuring out what was going to be safe on the buses. And I just love that video. So I wanted to share that. This is my last slide. I just wanted to touch on this. This is this idea of anger and threats towards people who are in the public health world. And I think this is something, and you know, again, those of you who are following the news today, really horrifying news coming out of East Lansing. You know, the idea that people plotted to kidnap our governor over some of the public health issues. And again, I think some of those details are emerging, but you know, that's a, you know, an extreme case. But I have to say that I think there's been a real lack of civility really across the country in this space. A lot of anger directed towards people who are just trying to do their job. And you know, it's not simple. You know, I've shared that I get a lot of emails, mostly from faculty and parents, and a lot of them are not very nice. I mean, it's a little painful to read them. But I also remind myself that on the other side is someone who is probably feeling a lot of distress. And so, you know, I'm trying to understand that and trying to be better. But I just wanted to share that with all of you. And I also want to just close my comments with just a thank you to all of you for everything you've been doing. My goodness, so many of you are working in different research spaces and clinical spaces, you know, just helping our campus community navigate this just remarkable and uncertain time. And I'll leave you with my last slide, which is a picture that we took a few weeks ago, just this lovely sunrise in beautiful Michigan. So I'll end there.
Thank you. Thanks so much, Preeti. Just so much really interesting information. Does anyone have any comments, questions? We have a few minutes to chat and converse with Dr. Malani regarding this really unprecedented time that we're in. I really loved that video that you shared. That was, you know, I've been so impressed by some of the innovations coming out of, you know, such a somewhat depressing time. So that was really fantastic.
Yeah, and there's more stuff coming out, including from a number of IHPI members. You know, Amy Cohn and her team have been working to try to figure out how to do this testing. Like I mentioned, the logistics of so much of this, it's just beyond, you know, if like in your regular world, like it's busy and hard. But then you take this whole different layer on it, and we're not really resourced differently. I mean, a little bit differently, I think that's the other piece I wanted to mention is that public health has been chronically underfunded. And, some of the things that people say, like, how can you not know, where someone lives and like who got exposed where? And it's because there aren't resources to do some of this stuff. And I think that's varies from state to state and location to location. And we were very fortunate. And I didn't mention this in my comments that to boost case investigation and contact tracing, we actually brought in some of our school public health experts and including some student volunteers.
Great. We have another question from Kara to you, Kara Gavin. I'll read it out. It's a great question, so I think it might take a little bit of time for you to answer it. But what is the role of researchers in measuring the effects of what U of M and other campuses are doing and translating it into resources that can inform other campuses?
Kara always asks great questions. Thanks, Kara.
She does.
So, the most sort of basic biology one is one that my colleague from infectious disease, Adam Loring, is part of. And he's part of a CDC study that's actually looking at typing the viruses that our students become infected with, and then what's happening in the community. And is there any suggestion that infection spread from campus to the community? Because that's one of the unknown questions.
Right.
And he's doing it here. They're doing it in University of Wisconsin, which those of you, and some of you may be alumni from some fellow Badgers here, Wisconsin's had a really hard time on their campus. So it may look different in Wisconsin than it looks here. So that is one of them. Obviously, people are looking at the pieces around education. They are looking around the testing, logistics. I feel like every aspect of this could help inform how we do things differently moving ahead. Some of this, hopefully we do get to a point where we are on the other side of this, and I don't know when that's going to be. It can't be soon enough. I think certainly in the education space, some of this is going to remain. But anyway, Adam's piece was something that immediately comes to mind.
Yeah, and please, everybody, if you have other questions, go ahead and type them in the chat. I've been wondering if there's any initiatives. You sort of alluded to this, but are you aware of anything more formal, like in terms of young people on campuses with COVID, kind of registry-based studies going forward to follow? You hear so much about, young people get mild cases and they're fine. And I shared this with you before the group started, but I'm happy to share it here. My own college daughter just recovered from COVID, and she's not really fine. It's not just physical, but it's also the piece you were mentioning in terms of mental and emotional, having to be quarantined for 2 weeks. Are there any, that seems like an opportunity. Are you aware of anything that Michigan is doing or other campuses?
So Sarah, the thing that comes to mind, and there are probably others, but on the athletic side, and I've been part of the Big Ten's return to play planning, which has been interesting. So I don't want to say it too loudly that I'm part of that committee, but it's interesting. There was the infectious hazard team, and then there was the return to play group that continues to meet. But one of the issues is the myocarditis and plans for a registry. And Ohio State is going to be the center. They're going to do the IRB for that. And again, because I'm not involved in those details, but this is one that there's a lot of unknown. And this is mostly in football players, but we need to know how this affects other athletes, women, other sports. And is it unique to athletes, or is it something among young people? So I think there are a lot of unknowns, and this idea that this is harmless is certainly not true. The denominator issue remains unknown, but I think we're in a situation where we are going to be picking up a lot of cases that you wouldn't necessarily pick up clinically. So it gives us an opportunity to better understand the biology. And this virus that has changed humanity, we still don't understand basic biology about it.
Right. Well, hopefully, you always hope that these opportunities can come forward. And I think that seems like one, to form the registry and kind of study young people going forward prospectively seems like one that hopefully will happen. Other questions, comments? thoughts from our members?
Looks like there's
I
one
know a
in
lot of folks are
chat.
doing, oh, here we go, from Valerie. Why are occupancy limits in the hospital much higher than in the research labs? Even non-patient care spaces like elevators have posted occupancies 2 times higher. And often most people pile in, including employees. Thank you for all you're doing. I echo that.
Thank you. So I'm actually not involved in although I work there, I don't know all the reasons. I think some of it, frankly, is practical because this is, people have to work within a small clinical space. And I do think that they are trying to have decreased density. They've asked people who don't need to be there to not be there. But I have personally witnessed people cramming into the elevator, but the elevator ride is pretty low. And if people are masked, it's probably okay. There have fortunately not been cases of transmission that I'm aware of that have occurred at Michigan Medicine other than in social settings in recent times. But you're right, it's very different. And I actually kind of highlight it as by no means should campus look like the hospital, but the fact is we can go into the hospital cafeteria and sit down and eat in the corner and feel safe. And we need to help socialize that on campus. And that's a hard thing because, this is a scary illness for people. And, some things that are safe, it's like we can't just say, oh yeah, go do this, it's safe. There's a lot of like mixed messages and things. So it's a good question. But I think I will say at the hospital, things have gone pretty well. And it may be that because it is a hospital, you also have a little more control in terms of the patients, like they're all being tested. Now, their visitors aren't all tested. So there are things we gotta keep being careful there.
Thank you. Yeah, there's another question here from Brent Fries. Have you considered pooled testing? You can probably read these now, Preeti, that you're
Yeah,
done.
I can see them.
Okay.
Yeah. Thanks, Brent. The pooled testing, I believe that there is some aspect of that that's going to happen with the saliva testing. This has been something that is, just this idea with pooled testing, running multiple tests at once, and then if there's a positive going back, it is some. It'll be an element of it, but it won't be all of it. And again, I think as we get better at testing and, we may get to the point where that's what everybody does every day, like they test themselves. I don't know. I'm not sure we're going to get to that point. We may.
That would be very strange.
Like a blood sugar test, like the kind of things we do, but we're not there yet. And even with football, with the daily antigen, it's a kind of a limited setting. And I say it every day. And like, I know people are tired of me saying that, is that testing doesn't mean you can just give away everything else. You still have to watch your behavior. You still have to socially distance. And we're seeing it in the NFL, like there are cases. White House, there's cases. I mean, those are places where there's all kinds of testing. So they have to go hand in hand. And again, we had cases with our athletes over the summer, but it kind of simmered down and it went away. So I think part of it is that students have, whether the student athletes or non-athletes, they kind of have adjusted to life like this.
Mm-hmm.
Yeah, it could dramatically increase it. Again, I think those are discussions. There's some downsides to pooled testing. And right now, to be honest, the capacity they have, there's not as much demand for it. So they're not even, I think they're at the point where they can actually do more tests. I would encourage you to listen in tomorrow to the town hall, and there'll be some more discussion around testing. And at this moment, there's not a movement to mandate testing. Illinois has done that, where you have to be tested twice a week. We have not moved in that direction, but I think things could change and move and be different in the winter than they are now. Where the residence hall, for example, might be a place where people do need to be tested. And in those cases, things like pooled testing would be really important. It's about a vaccine, when an approved vaccine.
A great last question maybe to think about.
So when an approved vaccine comes out, positive thinking, do you think there will be efforts to? Yes, I do. And I just want to make a plug for one of the things that we did too is wrapped up the flu vaccine within the health fee this year and just said, just show up, no insurance card, nothing, just come and get your flu shot. And we do pretty well with flu vaccine uptake anyway on our campus, but the idea was we wanted to really do well, not 50%, but like, 80, 90, close to 100%. And so making it convenient, making it without out-of-pocket costs, making it without any hassle in terms of filling out forms and things. And they're doing that now. They are actually, Jason Shellhuss, who's at the health service, is working on plans for an eventual vaccine, like what that will look like. And again, wishful thinking, although I'm hopeful. Timing is unknown and priority groups are unknown in terms of when the students would qualify. But I think at some point we will be vaccinating them. And so it's important to think ahead, everything from temperature and stability of vaccine. And this is being done across the country at the state level.
Great. Well, thank you so much. We're at time. Thank you for a great presentation. Definitely, I concur. Thank you all for coming, and we look forward to our next presentation. Stacy, do you want to throw out the date? Thank you. I didn't have it written down. Jack Washington and Hallie Prescott will be speaking on November 18th, so please join us again. And again, thank you, Preeti, for sharing your time with us today.
Thanks, you guys. Yeah, and thank you for your interest in this. And again, thank you for your patience and support, because, it is really it is like making a boat out of a car. It's like, doesn't look good all the time, but it floats.
A huge undertaking for sure.